All right. Why don't we get this started? My name is Doug Lubinow, President of Senior Advisors. We're also going to have Justin on. He's Executive Vice President and Partner of Senior Advisors. And Rod Span is one of our agents in the Cranford Office, where Justin is located. The purpose of this seminar is strictly an educational seminar. We're not going to be trying to sell you anything. We're just trying to educate you on what happens when you become Medicare eligible, what the things you should look for, the biggest mistakes people make. And hopefully, I just thought about this before we got started. Hopefully we can explain the differences about all the TV ads that are on TV and how misleading these ads are to several people. We have thousands of clients, which creates several phone calls from our own clients saying, hey, this sounds pretty good, maybe we should do it. And they don't really explain what you're getting on those TV commercials. So hopefully, after we get done today, you'll have a little bit better understanding. And if those Medicare Advantage plans work for you, we can help you with that. But you should have a clear understanding, because this could be a lifetime decision when you make your first selection on Medicare that you might never be able to change going down the road. So we can get started on this. A little bit about us. I personally have been licensed in health insurance for 32 years. Started out doing group health insurance, and about 15 years ago, got involved with Medicare, and Medicare has become our primary business for the last 15 years. We started Senior Advisors in 2009. We have over 20,000 Medicare clients nationwide that we have this business. We have actually 3 offices now. We have a South Jersey office down in Moorestown. We have an office up in North Jersey in Cranford, and we recently in the last year opened up an office in Phoenix, Arizona. So that's a great, market for us. My other son and daughter-in-law live out there, and it's a great market. And we're licensed in over 30 states throughout the United States. So we're able to help people in most of the country. And we have several people up and down the East Coast. People relocate out of New Jersey, Pennsylvania, they head down to Florida, the Carolinas. So we're able to help those people even after they move. We work with all the major insurance companies. We work with Aetna, United Healthcare, Mutual of Omaha, Cigna, Horizon Blue Cross. So, all these carriers, we're not simply just a one carrier shop here. We work with all the major companies, and we assist our clients with helping them get enrolled in Part A and B, explain to them what they have to do. And then we talk about the differences in Medigap, Medicare supplement plans, and Medicare Advantage plans. And then one of the most important things I think we do for our clients is search for the best drug card every single year, because drug cards can change, and we're in the process of that right now. It's the time of year that we're doing drug card reviews for our clients. So today we're going to talk about how Medicare and Medicare supplements work together, Part D, prescription drug plans, and then at the end we'll recap it with the top 5 biggest mistakes that people make.
Just one quick comment before we jump in. If you do have questions throughout the presentation, please use the Q&A window in Zoom. So there's a chat and then there's a Q&A. If you have a question, please put it in Q&A and we will address those questions throughout the presentation. Thank you.
Thanks, Justin. Okay, so here are the different parts of Medicare. You got Part A, which is hospital insurance. So it's inpatient care. It also covers skilled nursing facilities. And usually there's no premiums involved with Part A as long as you work 40 quarters in your lifetime. You will get Part A, and you pay it into the Medicare system for those 40 quarters. You will get Part A with no charge. Your Part B is outpatient services. That's everything that takes place outside the hospital, falls under Medicare Part B. So it's all your doctors, all your tests, labs, MRIs, CAT scans, and very expensive items, infusion therapies that can be tens of thousands of dollars every month. And that all falls under Part B of Medicare, and that there is a charge for Part B. And the government charges you this year, the base amount is $148.50. It's also income adjusted. We're going to get into that shortly also, on how people with higher incomes can pay more than the $148. But Part C of Medicare is a different type of coverage where you're no longer using your Medicare card. You do have to have Medicare Part A and Part B, but you buy your insurance now from an insurance company and you're using their card instead of using the red, white, and blue Medicare card. So you're going to have a card from Aetna or United Healthcare or Blue Cross and Blue Shield, and that'll be the only card you have. And Part C is a managed care type of plan where the insurance company is now responsible for paying all your claims. And, you know, they're going to manage the care that you're going to have. And we'll get into that a little bit more, you know, in the next couple of slides. And then the Part D is your prescription drug cards. And the prescription drug card is purchased from a private insurance company. In the state of most states, there's 25 drug cards available for next year. This past year, we had close to 30 cards. Next year, we're about 25 cards in every single state. And it's really an important decision that you get the right drug card to meet your needs. And that's something that Justin's going to do a full demonstration of how that works, you know, in the second half of this presentation. So here's what you'd be paying Medicare for your Part B based on income. So the base amount is people that are making $88,000, filing single, making $88,000 or $176,000 as a couple. They'll pay the $148.50 a month for Part B. If your income is above those levels, it goes up to $207. And then the next bracket is if you're over 222 as a couple, it's 297, and then 276 and above, it goes to 386. And if you're over 330,000 as a couple or 165 as a single, you're going to pay $475 a month. And the top bracket are people making over 500,000 as an individual or 750 as a couple. They pay the $504.90 per month for Part B. But that's not the only amount that gets adjusted. There's also an adjustment under the drug card, the Part D. If you're under the 88,000 or the 176, there's no additional income adjusted amount. You just pay the premium for the drug card. So each drug card will have a premium. It can be anywhere from $7 up to $100 a month on a prescription drug card. And we'll get into that more later. However, if you're in those higher income brackets, like I just went through with the Part B, you will get an income adjusted amount, and it can be $12 more, it can be $31, it can be $51, it can be as much as $77 more a month if you're in the highest income bracket of 500,000 single or 750 as a couple. So you have to put those two amounts together. So the next slide is going to show you the total amount that one would pay. And again, I want to stress that these are the amounts for 2021. When they look at these numbers, they look at your income from 2 years previously. So this year, people that went on Medicare for the first time, they look at your 2019. They have not released the income amount and income adjusted amounts for 2022. We expect that out any week now. Usually it comes out mid to late November. So these numbers will change somewhat in the next couple of weeks for next year. So for 2022, they're going to look at your 2020 tax return. So here you can see the base amount is 148, and then as it goes up to 220, if you're over 330 as a couple, it's 545 a month that each each person, husband and wife, would have to pay almost $1,100 a month, and the top bracket's 582 a month. So people with higher income are expected to pay more money for their Medicare Part B and Part D drug cards. That sometimes is a shock to people that they didn't realize that. So, you know, people all the time, we're at a lot of people and they say, well, I'm retiring now. And yeah, I made $400,000 when I was working, but I'm not gonna make $400,000 after I retire. I'm looking to make $200,000. Well, then you have the right to appeal it. When you get the letter, the letters go out late November and December for next year. And you get the letter saying, hey, you owe the $545 a month. And you say, well, my income is down. Maybe my income is below the 176, which is the base amount. You have the right to appeal that. And one of the reasons is work reduction. You're retired. You're no longer working. The income stopped. All you have coming in is Social Security, maybe money you're taking out of an IRA, or maybe you got a pension. So you really have to figure out how much you think you're going to make in 2022, and you appeal it. And Social Security will adjust the amount that you have to pay. And there's no reason that you should pay 2 years before it works through the system automatically. You should appeal it immediately once you retire and your income goes down. All right, so when should you apply for your Medicare? If you're not working and not getting group health insurance, then you must apply for Medicare at age 65, and you can apply 3 months before your birthday. So in this example, your birthday is September 10th. You're always eligible the first of the month that you turn 65. There's one exception to that. If your birthday is on the first of the month, you're eligible the previous month. So if your birthday happened to be September 1, it'd be August 1st that you're eligible. But in this example, it's September 10th. So 3 months before is June 1st. You can go online and apply for your Medicare benefits. You can go online at Social Security Administration.gov, which is ssa.gov, and just go on and follow the links to apply for Medicare benefits. You do not have to enroll in Social Security at this time. A lot of people get confused, saying, well, I don't want Social Security now. You don't have to take Social Security, but you do have to enroll for Medicare if you're not working and you don't have group health insurance. So you have 3 months before you're 65, the month of, and 3 months after you become 65. However, and if you wait longer than this and you miss your open enrollment period, they'll make you wait until the general election period, which is in the January to December timeframe, and not give you Part B until next July. So that's how important it is. You can end up with no health insurance. And I have a couple of people right now that did not know when they were supposed to apply. They lost their health insurance in July this year, and they will not have Medicare Part B until July next year, because they cannot apply for Part B until January, and they'll give it to them in July 1st next year. So they went a whole year with no health insurance. So it's very important that if you're not working, you don't have group health insurance, that you do sign up for Medicare when you're first eligible. Now, there is a problem right now that if you sign up after your eligibility month, they're going to make you wait an extra month for every month you wait. So if you sign up 3 months after your eligibility date, they're going to make you wait another 3 months before they give it to you. So technically, it'll be 6 months after your eligibility month that you'll get your Part B. This has been a problem that's going on for years. It's been in the Medicare system, and we have been going to Washington. I personally have been in Washington almost probably 30 years, lobbying on healthcare issues. Justin's been down for the last probably 5 years that he's been in the business, 5 or 6 years, working very closely with Centers of Medicare and Medicaid Services on this issue. And through our association and our lobbying efforts, we got this change, but it won't go into effect until 2023, that this whole situation of making people wait will go away. In the future will be until in January 2023, you'll get covered the month after you enroll. So if you're a month after your birthday, 2 months after your birthday, you'll immediately get the Part B the next month that you apply. Again, it's a great change. It took years to get this approved. And if you know anything about Washington and getting bills approved, it takes forever to make changes in Washington. And this was a big, major change that will benefit thousands of people going forward. So, I mentioned if you have group health insurance and you don't need to apply for Medicare, there is one caveat to this. If you work in a small company with less than 20 employees, then Medicare is primary. So you do have to have Medicare if your company has less than 20 employees, people on payroll. It's total number of people on payroll. If there's less than 20, Medicare is primary. You do have to have A and B. It usually is less expensive for that employee to go on Medicare, since it's got to pay the Part B anyhow, and get a Medicare supplement. And the employer even has the right to pay for the supplement and the drug card if an employee wants to go on, because Medicare is primary. So you're not breaking any laws. You're not encouraging a person to come off the group health insurance. But it's a win-win. The employee gets much better coverage, and the employer can save a lot of money. They're probably paying $800 a month for an employee. And this way it could cost them, the supplement and drug card will be less than $200 a month. And the employee can be, responsible for paying the Part B premiums. So that's a suggestion we make to all of our, small companies with employees that are turning 65, that get them off the group plan, and it's win-win. The employee gets better benefits and the employer saves money. Now, if the employer has 20 or more employees, the group health insurance is always primary. So those people working for a larger, companies with 20 or more employees, you do not need Medicare. There may be some discussions that could be had for people that want to come off Medicare. Is you have a choice as an employee. It's your option to drop off the group health insurance plan. You cannot be forced off the plan. It's against the law, but you can make a decision. We get lots of phone calls. We have discussions. If you're paying $100 to $200 a month, maybe for you and a family or you alone, normally we're going to say it's probably better off to stay on the group health insurance. Here's an example. You have to pay $600 a month to have a spouse covered who's turning 65. Well, now we have a good discussion, because maybe for $148 and another $160 for a total of $300, your spouse can be on Medicare, have better health insurance, and could come off the group plan. You save yourself money, and the spouse at 65 can save a lot of money. So that's a discussion that could come up. Husband and wife can have a high deductible plan, have to meet a $5,000, $6,000 deductible. And every year they're meeting the $5,000, $6,000 deductible, and it's out of pocket. Maybe it would be better for that employee and spouse to drop off the plan and go on Medicare, pay less money than that $5,000 and have almost a 100% coverage. That's another discussion that we can have with people. So there are some possibilities that it might be better for people to drop off the group health insurance and go on Medicare. But again, you cannot be forced off the group plan. There is a little difference to that if you're disabled and you're on Medicare through eligible for Medicare through Social Security disability. If an employer has less than 100 employees, then Medicare is primary for the disabled person, whether it be an employee or a spouse. You do have to have Medicare A and B. So again, it's very important that if your spouse is disabled and becomes eligible for Medicare, and you work for a business with less than 100 employees, Medicare is primary. And you have to make a decision in that case, is it better to stay on the group plan or get a Medicare supplement and drug card? If the employer has 100 or more employees, the group plan is primary, and the disabled individual that's eligible for Medicare does not have to take Medicare at that time until they lose the group health insurance. Another time that's important is any retiree plan that you may be on, you're entitled to Medicare, and Medicare is always primary. Just had a situation this week. An individual lost their job last December. The company agreed to pay 1 year of health insurance for the individual. So the individual took the free health insurance, never signed up for Medicare, and technically they were on COBRA for that 12 months. That's the next one. Medicare is always primary if you're on COBRA. So losing your group health insurance, you basically have an 8-month window to sign up for Part B without being penalized. However, this individual just called us last week for the first time in the month of either late October or November. They cannot get Part B now until signing up in January. They'll get it next July. They're going to lose their employer health insurance at the end of this year. So for the next 6 months, from January to July, they will have no health insurance other than Part A of Medicare, because they did not understand that they should have had Medicare while they were on COBRA, even though the company, they thought it was considered group health insurance, but they were not actively at work. So again, Medicare told them, Social Security told them, you can't apply until January, and we'll give you Part B in July. So, I mean, it's a hard situation. If somebody was treating a condition like cancer, had chemotherapy treatments, and they had no Part B, there's nobody to pay for it. You cannot buy individual health insurance if you're over the age of 65 and eligible for Medicare. So you have no health insurance. So again, don't make that mistake ever. So when do you enroll? You're turning 65. If you're already in Social Security if you already applied, let's say 62, you apply for your Social Security benefits, you will automatically be enrolled in Medicare, Part A and Part B. If you don't want Part B because you have other coverage, you have to decline the Part B, send it back to Social Security and say you don't want it at this time, and they will stop it and not, take you off of the Part B. So you're turning 65 and you're not enrolled in Social Security, then you do have to enroll online, and you go to ssa.gov/benefits/Medicare. If you go to ssa.gov and follow the prompts, there's a menu of items, and just it's a pull down, just say, look for Medicare benefits and apply, and follow all the links and apply, and make sure you want Part A and Part B if you want Part B. If you enroll after the age of 65, it's a little different, because you now have to prove to Medicare or Social Security that you've had group health insurance. So there's two forms that you need. We have these forms, we supply them to our clients. A lot of HR departments have. I just had a call earlier today, and the individual said, yeah, my HR department sent me a printable form. It was great. And I work for some very large companies, and they never keep this form. Every time they say to the employee, you bring me the form, we'll fill it out for you. So this form gets completed by your employer, and all it does is show the date you've had group health insurance and the dates you've been employed, and you fax that into your local office of Social Security, and they'll start the Part B. We used to always tell our clients to walk it into your local office and make sure somebody has this and start working on it, but the offices are still closed. I understand they're starting to take appointments only, and it takes 6 weeks or 8 weeks to get an appointment with Social Security, so you're still better off to just fax it into the local office. But you have to prove that you've had group health insurance since you've been 65. The only time this is an issue is somebody's 75 and going on Medicare for the first time, and they work for 3 different companies between 65 and 75. They're going to have to get this form completed by each company that they work for. They have to document every year that they had group health insurance from 65 to the date that they're applying for the Part B. So most people have one job and one company, in that time frame, and it's a lot easier. But again, if you have multiple companies, you have to get this form, and you do need this form completed for a spouse. If the spouse has been on your group health insurance all this time, you have to prove that they've had group health insurance if they're over 65 too, or else, you'll be penalized and not get Medicare until the following July. So again, it's a pretty simple process. And you just have to get this over Social Security, and it usually works out pretty well for you. All right, I'm going to turn it over. I think Rod's going to take over a little bit to explain to you the differences between Medicare supplements and Medicare Advantage plans. It's all yours, Rod.
All right, thanks so much for getting us off to a good start, Doug. So now we have the foundation in essence to how Medicare works, when we should be enrolling, and some of the mistakes that we don't want to make, or you all don't want to make, especially when it comes to your health insurance. So here we have this nice flow chart that will help us to kind of understand the directions that we can go in regards to our Medicare coverage. On one side, we have original Medicare and a supplement, and the other Medicare Advantage plan. The main difference is basically, as we can see on this chart, Medicare Advantage, also known as Part C, it bundles all of Parts A and B of Medicare, which is that hospital and medical insurance, as well as Part D, which is the drug card, prescription drug coverage, bundles it all into one plan. And as was mentioned, these are fully privatized insurance policies. So they're going to operate more like an HMO or a PPO, where you're going to have a network of doctors that you have to operate with. That's how Medicare Advantage works. Part C bundles all of those parts together. Now, the other route is original Medicare. Basically, these are standalone plans. You have Part A and Part B of Medicare. Those two together make up original Medicare. Secondly, you have the choice to decide which drug plan you want to work with, right? As was mentioned by Doug, there's about 25 different drug plans available in each state. We'll go into more detail about how you can find the most suitable plan for you. But that's the next step if you're going to go the route of a Medicare supplement, you're going to need a standalone Part D prescription drug plan. And then lastly, you'll want to choose a Medicare supplement insurance plan, also known as a Medigap policy. These help to cover the cost of original Medicare, what original Medicare does not cover, and it still allows you to benefit from the freedom that original Medicare gives to you. And we'll go into more detail in the next slide. So what are some of the main differences, right? We have those two routes that you can go: Medicare Advantage, original Medicare, and a supplement. So the main difference is really how they work in regards to your original Medicare, Parts A and B. When you're on original Medicare, you have the freedom to go to any hospital, any provider, any specialist that participates with original Medicare. Right now, that's 99% of hospitals and over 90% of providers anywhere in the United States of America and its territories, right? If you're on original Medicare and a supplement, the supplement works right alongside that. So you still have that freedom to go where you need to go, whereas a Medicare Advantage plan actually replaces this original Medicare benefit. So instead of being able to go pretty much wherever you would like, you have to abide by the rules and the terms of that specific Medicare Advantage plan. So instead of working alongside Part A and B of Medicare, it replaces those benefits. And again, in regards to private networks, the Medicare Advantage plans, they operate more like an HMO or a PPO. So the majority of them, you have to a number of them, you have to go to the doctors within that network. Otherwise, you'd be responsible for 100% of the cost. With original Medicare and the supplement, there are no networks. Again, you can go to any doctor, any provider, any specialist that participates with original Medicare. And again, that's a very, very large portion of doctors and hospitals today. In regards to referrals, right? If you want to see a specialist, if you need to get any type of testing done, with original Medicare and a supplement, there are no referrals required. With Medicare Advantage, some plans do not require a referral. A number of them do require a referral. So that means basically you would have to go to your primary care physician. They would have to give you prior authorization in order to get any specific type of test done. Or if you want to see a specialist, you would have to receive approval from your primary care physician before you go and get that extra care. With the original Medicare and a supplement, no referrals needed. If you need it, if you need the care, if you need the test, if it's medically necessary, you're free to go. In regards to Part D, that's again another difference. We talked about how Medicare Advantage plans, these are the ones that bundle all of your coverage options together. So Part D is generally included with a number of these Medicare Advantage plans. So you won't need to get a standalone Part D prescription plan as you would with a supplement. Rather, it would be built into the specific Medicare Advantage plan that you choose. For premiums, there's a difference there as well, which many people, that's where you'll see the biggest disparity. The majority of these Medicare Advantage plans are provided at $0. So these are low cost plans. There's not a lot of out of pocket on a monthly basis, but generally there's co-pays and co-insurances when you want to utilize the plan. So they're generally, again, lower premium, some even $0 per month. On the other hand, if you're going to be picking up a Medicare supplement to work alongside your original Medicare, you'll generally see a higher monthly premium. But as we'll go to the next line, you'll see a lower out-of-pocket cost, right? So the premium is gonna run you a few dollars every single month, but the out-of-pocket cost, the co-pays, the co-insurances, the deductibles, these are generally much lower with a Medicare supplement plan, which is nice because there's not a lot of variable costs. You're able to keep track of or to calculate exactly what your expenses are going to be. With the Medicare Advantage plan, the maximum out-of-pocket cost this year is $7,550. this number can be reached basically by, co-payments for going to the doctor, co-payments for seeing a specialist, co-insurance. If you have to go to the emergency room, if you're admitted into the hospital, if you're there for a few days, or if you need to get transferred to a skilled nursing facility, there's co-payments, co-insurance, all the way up to this federal maximum of $7,550. So that's a big difference, and a thought to really give some consideration to. And then lastly, when it comes to guaranteed renewability. So guaranteed renewability means that as long as you have your plan, you're enrolled in your plan, and then you pay your premium, the plan cannot cancel you. You will not lose your coverage. Medicare supplements are guaranteed renewable. Again, as long as you continue to pay your premium, you stay enrolled in the plan, you're good for life. With Medicare Advantage plans, those do not operate under the same terms. Doctors, they come and go out of these networks, and plans change every single year. Not every plan changes, but a number of plans will change on a yearly basis. So there is no guaranteed renewability. And that's why we're in the annual election period, where if you are enrolled in a Medicare Advantage plan, you can take a look and see if there's a more suitable Medicare Advantage plan for you. So those are just some of the major differences. Now we're going to go into a little bit more detail in regards to these Medicare supplements. All of them are given plan letters. We're going to focus on just 3 of the most popular Medicare supplements: Plan F, Plan G, and Plan N. And as our chart will show us, it'll help delineate what Medicare is responsible for, what your Medicare supplement will help to pay for, and what you as the beneficiary will be responsible for. So here Plan F. How does it work in conjunction with Part A, which is your hospital insurance? Well, if we notice here, on the first 60 days, if you're in the hospital, Medicare will pay everything except $1,484. And that's for your room and board, general nursing, and any type of services that are given to you while you're there in the hospital. So original Medicare is going to pay everything except that $1,484. And that's, again, 2021's numbers. We still haven't gotten the numbers for 2022. They should be coming out in a few short weeks. But Plan F would actually pick up the rest of that amount. So that $1,484, instead of being your responsibility, your Plan F supplement will pay that. Now, let's say you're in the hospital more than 60 days. Well, days 61 through 90, Medicare will pay everything except $371 per day. And here, again, is where your Plan F supplement comes into play. They pick up that $371 daily copay, so you're responsible for nothing. Now, if you're in the hospital for even more than 90 days, from days 91 and after, Medicare will still continue to pay, but that copayment that would be your responsibility is now $742 a day. Plan F covers that $742 copayment, and still, again, you're responsible for $0. So how does Plan F work when it comes to skilled nursing facilities? And when we say skilled nursing facilities, we're not talking long-term care or custodial care. Basically, this is rehab. You're in the hospital for at least 3 days. Let's say you need to get a hip replaced or a knee replaced. So you're in the hospital for 3 days, and you need to get rehabbed. You need to get back on your feet, right, so to speak. If you move into a skilled nursing facility, the first 20 days of that stay, Medicare, original Medicare Part A, will cover it 100%. After that, days 21 through 100, they'll still continue to pay a portion, but you would be responsible for $185.50 per day. Plan F then picks up that $185 so that you, again, will be responsible for $0. So we can see clearly here on the last portion of this, the last column on this slide, with Plan F, when it comes to your hospitalization, if you are put into the hospital or a skilled nursing facility, Medicare is going to pay their part. Your supplement, Plan F, is going to pay the other, and then you'd be responsible for nothing. So it's a really good plan. And so how does Plan F work with Part B? This is everything outside of the hospital. So your medical expenses, if you're visiting the doctor, any type of outpatient services or surgeries. With Plan F, the first $203 of any Medicare approved service would actually be your responsibility. That's called the Part B deductible. With Plan F, though, instead of it being your responsibility, they cover that Part B deductible as well. So that $203 is covered by them, and you are responsible for nothing. After that, Medicare pays 80%, and then your Plan F supplement pays the other 20%. So you're 100% covered for medically necessary services. Now, one thing to note about Plan F, it is a very complete plan, but it's only eligible now for those who qualify for Medicare before January 1st of 2020. Now, that doesn't mean that you had to be enrolled in Medicare before January 1st, 2020, but you had to be eligible. In essence, you had to qualify for your Medicare benefit, even if you have not yet enrolled. So Plan F is an excellent plan, but now we're going to go into our next slide. Plan G, right? So there's only a short piece that we have to show here, because the difference between Plan F and Plan G really isn't that big of a difference. Plan G is exactly like Plan F in regards to what it covers and what you'd be responsible for, except for the Part B deductible. With Plan F, that Part B, that $203, the first $203 of any Medicare approved amount would be your responsibility. And with Plan G, the supplement doesn't cover it. You would actually pay that $203. After that, you're 100% covered for medically necessary services. Medicare pays 80, and Plan G pays the other 20%. Now, Plan N, which is again another popular plan that proved to be cost-effective for many. Plan N is exactly like Plan G. So you're responsible for that $203 Part B deductible. That's the portion that you pay before there's any cost sharing. With Plan N, there's also co-payments. It's up to $20 for office visits. So that's doctors or specialists. So up to $20 for any office visit, and up to $50 for an ER visit. Now that visit to the emergency room, that $50 is waived if you're admitted into the hospital within 24 hours. And in regards to the up to $20 copay for doctors and specialists, the reason it's worded that way is because not every doctor is going to charge you the $20. Some will charge you $5, $10, 15, but the maximum that they're able to bill you is $20 per office visit. And that's Plan N. One other portion that is generally covered by Plan F and Plan G is what's referred to as Part B excess charges. It's not something that's very common, but it is something that you need to be made aware of. With Plan N, you're responsible for these excess charges, which in reality are 15%. It's a 15% charge on top of the Medicare approved amount, right? Because Medicare has an approved fee for every service that all these providers agree to. With excess charges, the provider is able to charge up to 15% more than that Medicare approved amount. With Plan N, you would be responsible for that charge. So when can you actually enroll into one of these Medicare supplements or Medigap plans? Well, the first is your 6-month open enrollment periods, and that coincides with when you sign up for your Medicare Part B. So you have 6 months after your Part B effective date to get into any of these Medicare supplement plans with any of the carriers, no questions asked. After those 6 months, then you would have to go through medical underwriting in order to get one of these supplement plans. You also qualify for an open enrollment if, let's say, you were disabled and you are enrolled into Medicare before you turn 65. Well, once you turn 65, that triggers another 6-month open enrollment period to get into any one of these Medicare supplements, either a Plan F, Plan G, Plan N, with no questions asked. So for that 6-month window from you turning 65 or your Part B goes into effect, you have an opportunity to get into one of these excellent plans with no questions asked and no medical underwriting. Now we'll give our attention to Justin. He'll go into Part D of Medicare.
Thanks, Rod. And thanks for that overview. So we have definitely covered a lot of ground so far between Doug and Rod. Just to kind of recap the different parts of Medicare, the amount you pay the government for the Part B premiums. If you're in a higher income bracket, how much you pay the government for those Part B premiums. We got into when to sign up for Medicare, how to sign up for Medicare. And then Rod covered really the differences between Medicare Advantage and original Medicare with the supplement. So if you do have any questions on anything we've covered, feel free to, again, put those into that Q&A window and we will address those throughout the presentation. Now, we are going to shift to our third section, which is Part D of Medicare. And there's about 25 different Part D plans available. So Rod had mentioned that earlier. And there's a tool that we use on Medicare's website. It's called the Medicare Plan Finder to identify the most cost-effective Part D plan for each individual. And I'm going to show you a demonstration of that tool after I walk through this slide, which this slide is really intended to give you the framework for how Part D of Medicare works. So all 25 of those Part D prescription plans have to follow certain rules with Medicare. And these are those rules that they all have to follow. And we consider these kind of steps, if you will, within Part D of Medicare. And the first step is the deductible. So these Part D prescription plans can have a deductible, and I'm just going to talk about next year's numbers because we're already almost in 22. The deductible can go up to $480. Okay, so some of these plans might have a $0 deductible, some might have a $200 deductible, but it can't be any higher than $480 for next year. Now, these plans that have a deductible, on most of these plans that have a deductible, the deductible only applies to higher tier drugs. So if you just have low cost, tier 1 generic drugs, then even if your plan has a deductible, you still might only pay a $0 copay or a $1 copay, even without having to reach that deductible. So it's really for those higher tier medications where you'd have to meet that deductible before getting to a copay. So that's step one. Step two is the initial coverage level. Okay, and about 85% of Medicare beneficiaries aren't going to get past step two because their total drug cost is less than $4,430 for the year. And this is based on the retail cost of the drugs, not the copays and things that they're paying while they're in the initial coverage level, but based upon the full retail cost. As long as the total cost of their drugs is less than that $4,430 for the year, they're just going to be stuck in this step two initial coverage level for the entire year, where they're going to pay a copay or co-insurance for their medication. It might be $5, $10, $40, but it's going to be kind of similar to like a group insurance where you've got a copay for your medications. Where it starts to get confusing and also can be very costly for people is if you do have expensive medications that exceed this $4,430 for the year. If someone has those again, it's only about 15% of people, but if you have those medications, you reach this step three, which is called the coverage gap. And historically has also been known as the donut hole with Part D of Medicare. And if you reach that donut hole, you have to pay 25% the cost of the medication. So again, not many people hit this, but if you do, it can be confusing and expensive. So I try to give an example just to simplify this, this coverage gap and how this works. So let's just assume you're taking one medication, and you can pick any medication you see a commercial for. Any one of those, you're going to reach this coverage gap. Those are the expensive drugs that don't have a generic alternative, but a common heart medication is Xarelto or Eliquis. The retail cost of that medication is about $600 per month, okay? So if you're taking Xarelto, let's assume your plan doesn't have a deductible just for simplicity, you might have a $45 copay for that Xarelto on this Part D plan that you have. So when you go to pick that medication up in January, you pay that $45 copay. February, you pay the $45. March, April, May, you just keep paying that $45 copay for your month supply of that drug. Now, once you get to July or August, now you're 7 or 8 months into the year. And if you remember, I said the retail cost is about $600 per month for that medication. So once you get into August, you're 8 months into the year times that $600 a month retail. It doesn't mean you spent $600, but you've consumed that full cost of that drug goes towards this initial coverage level. So now you're at, August, and you go to pick up that same medication, and now you're in the coverage gap because you've exceeded this $4,430, and now you have to pay 25% the cost of that drug. So instead of the $45 copay for that Xarelto, now you're paying $150, for example, 25% of that $600, right? So this is where, again, it can be confusing as well as costly if you have those expensive medications. But that's just a one drug simple example where you're paying that $45 copay all year. You get to August and now it's $150. September at $150. You're paying $150 a month the rest of the year. Okay, so that's the coverage gap. Step 4 is called catastrophic coverage, and that is there to protect you so you're not stuck in the coverage gap for the entire back half of the year. If you have very expensive medications, you're not stuck paying 25% for the entire back half of the year. At a drug like Humira, for example, the retail cost of that, I think it's up to almost $5,000 a month for that Humira medication. If you had to pay 25% of that, you're talking $1,200 a month for every month of the year. That would be obviously very, very expensive. So this catastrophic coverage is there to protect you so you're not stuck in this step 3 the entire back half. And that's only if you have very expensive. Only about 4% of people reach the catastrophic level, and they would pay 5% the cost of their drug instead of the 25% once you get to that step 4. All right. So I wanted you to understand some of these terms so that when I show you the tool, the Medicare Plan Finder tool next, you're going to see some of these terms show up. And I wanted you to understand how they work with these Part D plans for the initial coverage and coverage gap and catastrophic. So, all right, I'm going to shift now. I'm going to stop sharing this screen to show you my internet Chrome browser. So just give me a minute here. But the tool I'm about to show you is a tool that is available for anyone. So it's right on the Medicare website. Just make sure this works. I'm sorry, just trying to share my my browser window. Just give me 1 minute here. But the tool I'm going to be showing you is available right on the Medicare.gov website, which it's for some reason here we go. Rod, can you just confirm? Are you able to see my browser window? Okay. Let's try this again.
Hey, Justin, I see it.
You do see it?
Yeah.
Okay, thank you. Okay, so let me just cancel this. You can still see it?
Yeah, it's there.
Okay. You're seeing Medicare.gov, correct? The website?
Yeah, find Medicare plan.
Now you're looking at the slide. Let me just stop that. Hold on.
Oh, that's a slide?
Let's try this again. Okay, you should be able to see my browser now.
Yes.
So, okay, thank you. All right, so I'm going to just quickly walk you through a demonstration. Again, this tool that we use to identify the most cost-effective Part D plan is the same tool that's available for everyone. It's right on the Medicare website. So we just like to show you how to use that if you want to do this on your own. You go to medicare.gov, and right here on the front page, there's a button that says Find 2022 Health and Drug Plans. So if you click that, it takes you into this Medicare Plan Finder tool. And this tool was upgraded about 3 years ago now to allow a user to log in to your mymedicare.gov account. So if you do have a login, you can log in, and it allows you to save your drug list. You don't have to keep re-entering it year after year. So that's a nice feature there. For the purpose of this example, I'm just going to do continue without logging in. Then it asks you what type of plans you're searching for. For the purpose of this example, we're looking at Part D prescription plans. I'd ask you to put in the zip code. I'm just going to put in our office zip code here. Do you get any extra help with any of these programs? This is for Medicaid, for example. For this example, we do not get any extra help. Then it's going to ask us to enter in our drugs. We're going to say yes. And then this is the screen where you actually put in your drug information. So this tool is going to look at all 25 of those plans to figure out which is most cost effective based upon a specific list of medications. So I'm just going to do a couple of examples. So the first one, let's pick a blood pressure generic drug, very inexpensive, amlodipine. If you notice, when I started typing in a few letters, it does pre-fill the list for you. So if you don't know the exact spelling, that's a nice feature there that helps you identify the right drug. You can change the dosage. So we'll just say we're taking 2.5 milligrams and once per day, which is 30 per month. Add to the list. So now that drug's been added to my list. I'm going to add one more medication, and let's see what happens if we put in a brand name drug. Crestor is a cholesterol medication, and it's a brand name. When you add in the brand name, the tool tells you there's a generic available. And generally speaking, if there's a generic available, none of these Part D plans are going to cover the brand name drug. So there are a few exceptions to that rule, but for the most part, if there's a generic available, you'd have to pick the generic. So we're going to take the generic for the Crestor, and we'll just take the default dosage, 20 milligrams once per day or 30 per month. So now my drug list is complete. These are the only two medications I'm taking, and I click done adding drugs. The last step is I have to pick my preferred pharmacies. You can now pick up to 5 preferred pharmacies because each of these Part D plans has a different pharmacy network, different preferred versus standard pharmacies, and the tool is going to figure out all the pricing for us based upon those pharmacies that we enter. I'm going to pick a mail order pharmacy, a couple of local pharmacies, and then I'll pick a couple of national ones as well. I'll put in Walgreens and CVS. And then I click done for my pharmacies. And now the tool is doing all the work for us. And it's looking at all 25 of those plans, and it's calculating the total overall cost for the year, which is the premium plus the cost of the drugs for each of those 25 different plans based upon the list of drugs that I entered. And then it's going to sort the list based upon the lowest overall cost for the year. So we're not just picking the lowest premium. We're not just picking the lowest copay. We're picking the lowest total. So we want the premium plus the copay. And in this example, and we're looking at plans for 2022, this SilverScript Smart RX is the one that came to the top of the list. It happens to have the lowest premium, which is $7 per month, but that's not why we picked the plan. It's this number right here is what we use to pick these drug plans. That's the yearly drug and premium cost. So that's that number. That's the golden piece of this tool, which is it calculates the total premium plus the copays into that one number for the whole year of 2022. And that's what's going to give us the idea of which is going to be most cost effective. So that number, $108, you can see this plan has a $480 deductible, but these drugs are lower tier drugs, so they're not going to really impact that deductible. So their total projected cost, which is the $7 a month plus the copays, comes out to $108 for the year. If we scroll down through the list, The next one in the list, $203. The next one, $337, $414, and so forth. If we go to the bottom of the first page, you can see $590. Now we're almost $500 difference between the one at the top of the list and this one at the bottom. If we go all the way to page 3, let's just see the least most effective plan for these drugs. You can see it's this plan happens to be almost $92 a month in premium. And you can tell just by backing into these numbers, the copays are significant on this plan for these two inexpensive drugs. You know, be like $1,600 a year between the premium and the drug cost versus, you know, roughly $100 with the plan that came up number 1. So it's really just going to be dependent on the medications as far as which of these Part D plans is going to be most cost effective for the year. So I'm going to show you a little bit more detail. If you click on the plan details, it actually gives you a lot more detail in this plan details. You can see the premium again. The total drug cost for the year comes out to about $24. You're going to see it's basically each of these are $1 a month for these tier 1 generics on the this plan. But you can see repeats the premium, the deductible, and it tells you for each of those pharmacies which are preferred, which are standard pharmacies, which is out of network. So you cannot use the out of network pharmacies. You can use preferred or standard. Preferred is going to be a lower drug cost than the standard. And then it breaks down each of those medications for the year. You can see what you would pay at the preferred pharmacy would be $12, which is basically $1 a month. And the same with mail order. The next part, it tells you if you're going to meet the deductible, if you're going to reach that coverage gap that we talked about earlier. And if you, as long as you're going to the preferred pharmacies, you're not going to reach the deductible or the coverage gap in this example, because these are two very inexpensive medications. Then you get the breakdown by month, which again is not incredibly helpful for this example because they're very inexpensive. But when we do the next example, this will be more beneficial. But you can see it's basically $2 a month for the medications, or $6 every 90 days for the mail order copays. Then it breaks it down even further by each of those pharmacies, so you can see what the monthly cost is for the drugs at each pharmacy, which you can see even before you reach the deductible, you only pay $1 a month for these two medications. All right. So lots and lots of detail in these reports, lots of good information about these Part D plans. And again, that was a pretty simple example. I'm going to do one more with more expensive drugs so you can see the impact that's going to have on this analysis. And it's a little slow just because we're using Zoom to share the screen. When you actually use the tool, it's actually pretty quick. I didn't mean to remove that, but that's fine. We're going to add in Xarelto, which is one of those medications I mentioned earlier. And we'll just take the default dosage, 20 milligrams once per day. And I'm going to put in Eliquis. It's very unlikely anyone would take both of these drugs because they both treat the same condition. But I'm just trying to get the numbers there so you could see the donut hole and the catastrophic so forth levels. So I put both of those drugs in just for a financial example. So if you're taking these 3 drugs, the tool is going to recalculate now which plan would be most cost effective. And let's see which one comes up and what the total cost would be for the year. And then we could get into the details and see when you're going to reach that coverage gap that we talked about and the impact that has on your costs with these medications. Okay, so in this example now, the one that came to the top of the list, it's called WellCare Value Script. It has a $12.90 per month premium. It has a $480 deductible. But again, that's not how we're picking the plan. This is how we're picking the plan, which is the drug and premium cost for the year, which comes out to $27.55 if you're taking these medications for the year. If you go to the next one on the list, $28.92, $29.63, and so forth, these numbers are going to keep going up and up and up until you get to the bottom there, a little over 3,000. Again, if we go to that third page, we're into the $9,000 and $10,000 because some of these even though they have higher premiums, some of these plans don't even cover these more expensive drugs. So just because you're paying a higher premium doesn't mean you're getting a better Part D plan. So let's now get into more detail with that plan that came up, the WellCare value script, so you can see by month how these drug costs work with this plan. So again, it shows you the pharmacy breakdown, what you're going to pay for the year for each of these drugs at each of the pharmacies. Here you go. This table shows us when you're going to reach the deductible, which is January, because those drugs are very expensive. You're going to hit that $480 deductible in January. You're going to hit the coverage gap. Remember that donut hole or coverage gap in May, most likely. This is just a model. It's based upon if you fill these drugs every month. It gives you a projected estimate, but you're probably going to reach that in May with these drugs. And then when you're going to get out of the coverage gap to catastrophic coverage would be November in this example. So now you can see by month, just for simplicity, we'll look at the CVS pricing. This is where you see those fluctuations and how much you're going to pay. So that first month is a big month because you have that $480 deductible. So that's why your projected cost is going to be $568. And then it'll drop down. While you're in the initial coverage level, you're going to be about $88 a month. Then you reach the donut hole or the coverage gap, and you're going to go up to that $266, $270 a month cost until you fall into the final phase, which is step 4, the catastrophic phase. Around November is like a partial month. December is the full month where you're paying that $57, which is going to be 5%, again, the cost of the drugs. So that just shows you when you have expensive drugs, you get these fluctuations in your monthly costs. It's not, you don't just divide up that annual number by 12 months and get you a flat monthly fee for these drugs. It's going to be all over the place, but the tool does all that calculation for us. Now, if you look at the monthly cost for each of these drugs at CVS, you can see the retail cost for the Eliquis, it's less than $600, about $530 a month. Same with the Xarelto, about $530 a month. The other drug, very inexpensive, about $4 per month. This is the cost before deductible. So really, it's kind of misleading because the deductible is only $480. But basically, you're going to pay that full cost until you reach the deductible. And then after the deductible, you have these copays. So $42 for the Eliquis or Xarelto and $4 for the Crestor. That's where you get that $88 a month for February through April or May. And then once you hit that coverage gap, remember that number, that $270 a month, because you're paying 25% the cost of these drugs, the $530 and so it's like $130 a month for each of these drugs. After the coverage gap, you pay the 5%, which came out to that $57. In this example, they didn't reach that catastrophic level until December, but you could see how that would bring down the cost eventually if you have very expensive drugs. So I know that's a lot of detail, a lot of information on these drug plans. We just would like to give you an example of how that works. Again, it's something we do for all of our clients when they first go on Medicare, and then we also do it every year. We send out reminders in September to get the latest prescription information for all of our clients. We rerun that drug report. You get one opportunity, October 15th through December 7th. Make sure you have the right drug plan for the following year. Even if your drugs don't change, those drug plans do change every year. So you want to make sure you're reviewing that to make sure you have the right drug plan each year. So I'm going to quickly go back now to the PowerPoint. And if you have questions, again, feel free to put them in the Q&A window. One other thing on the prescription costs. So there's these prescription assistance programs that are out there to help people with their drug costs. Some of these drugs are very expensive. This down at the bottom here, this is New Jersey specific, but every state has a prescription assistance program based upon income. If you're in a lower income bracket, you can get substantial benefits. They could pay for your Part D premium, and your drug costs can be set. The one in New Jersey, if you qualify for PAD, it's a $5 copay for generics and like $7 for brand name drugs, rather than those very high costs we just saw with that other example. To qualify, they increase these income levels for 2022 pretty substantially. Single income now is about $38,000 and below. and joint income, I believe it's 48,000 roughly and below, would qualify for that PAD program. And again, it's a great program where they pay the D premium and significantly reduce your drug costs. And there's another program called Senior Gold, which is a step above that. If you're making just a little bit more than the PAD levels, Senior Gold doesn't pay for your Part D premium, but they do discount some of your drugs, and they provide sort of a maximum drug cost for the year. They cap at a certain level, so you don't have to pay above a certain amount. So that's also a good program. Again, these are New Jersey specific, but each state has these types of programs as well. These other options up here, GoodRx is like a coupon website. It's not Part D drug coverage, but there's some cases where there's drugs that are less expensive on GoodRx than with your Part D prescription plan. So that's another good resource that's out there that you could always double check to see if you can get a better price. Glick is another one that is out there, and a few others as well. So I'm going to quickly recap now the top 5 mistakes people make on Medicare. And these are things that we've discussed already in the presentation, but we just recap them at the end. The first biggest mistake we see people make on Medicare is not enrolling in Medicare Part B on time. So Doug discussed this window, that 7-month window around your 65th birthday. If you don't have employer health coverage, that's really the time you have to enroll to avoid any penalties or delays in your Medicare Part B. The other situations Doug described was the COBRA trap. You know, if you're after age 65 and you're leaving an employer plan, you could technically get that COBRA coverage, but it's secondary to Medicare. So you have to have your Medicare coverage as well if you're going to take COBRA after age 65. Same goes for retiree health plans. You still need your Medicare A and B with those retiree health plans. This not enrolling on time also applies to the opposite scenario, where people that are working past the age of 65 for these large companies that are covered on the group health plan get misinformation, or they're confused, and they sign up for their Medicare Part B, and they're paying these premiums and these income adjustments perhaps for years and years, when it's not really paying any claims or anything for them, because the large group health plan is their primary coverage. And it's just horrible when we see that. I've got a couple I'm working with now that are in their mid 70s, and they've been paying, these tens of thousands of dollars in premiums to the government for their Part B for all these years when they didn't even need to have it. And so that's the other side of this coin. So you really want to make sure you're applying on time, which is, not late and not too early for the Part B coverage. The second biggest mistake we see people make on Medicare is not analyzing their prescription drug costs. We just looked at a couple of examples where it could cost you thousands of dollars a year by picking the wrong Part D plan based upon your medications. There's about 25 different Part D plans this year to choose from. We recommend using that Medicare Plan Finder tool, which looks at all of those plans to find which is going to be most cost effective. And you get one opportunity every year between October 15th and December 7th to review that plan for the following year and make sure you pick the right drug plan for the following year. The third biggest mistake we see people make on Medicare is not understanding the differences between Medicare Advantage and Medigap, or Medicare supplements. Rod did a great job providing the differences there, so you have an idea. But basically that Medicare Advantage plan, that's most of those commercials you're seeing. Our good friend Jimmy Walker and Joe Namath out there are really promoting those Medicare Advantage plans. Those are the fully privatized options, which where the insurance company takes over and fully manages your benefits for you. Very different type of coverage than original Medicare with a Medigap or Medicare supplement plan. A lot of people are lured into those Advantage plans because of some of those other benefits that they promote in those commercials and on the flyers and the phone calls. It could be things like dental cleanings or vision or hearing exams in those Advantage plans. But the actual medical coverage is not nearly as good as what you get with a Medicare supplement. With those Advantage plans, you could have up to $7,500 per year in out-of-pocket costs versus $0 to maybe a few $100s with a Medigap plan. and out-of-pocket costs. So two very different types of coverage. And it is a lifetime decision for a lot of people, depending on your state. Some states do not have underwriting for Medicare supplements, like New York and Connecticut. But for most states, when you first go on Medicare, that's your one opportunity to guarantee that you can get a Medicare supplement with no medical underwriting. After that first 6 months on Medicare Part B, that's when you have to go through medical underwriting to get into a Medigap or Medicare supplement plan. So the fourth biggest mistake we see people make on Medicare is not analyzing retiree health plans. So not many companies anymore offer these retiree plans, but there still are some out there that offer these retiree health plans. I've got a few now. I'm working with Bank of America, Johnson & Johnson. These are kind of legacy retiree plans that are out there. And basically years and years ago, these were great plans for a lot of people where they paid zero premium and they had pretty good coverage. But as companies keep pulling back on these benefits, the employee has to pay a higher and higher premium, and the benefits aren't as good as they used to be. So a lot of people just think they have a retiree benefit. They should take it. They shouldn't even check other options. When in a lot of cases, it might be better for them to go out on their own and get their own Medicare plans rather than that retiree option. Not to say everyone. I mean, if you're a teacher for 25 years and you have a zero premium retiree health plan, you're probably better off with that zero premium, retiree plan. But if you're a teacher for 20 years, you might have to pay $400 a month for that same retiree benefit when you could go out on your own and get a plan for $200 a month that gives you better medical coverage. So that's the fourth biggest mistake we see people make on Medicare. And the fifth biggest mistake is listening to your friends and family. And I can't tell you how many times in the last couple of weeks, even I've gotten phone calls from people about their neighbor, their friend, their cousin that has a certain plan, or that they want that plan for them. And Medicare is individual coverage. So everyone should really be looking at it based upon your needs, especially with things like the drug cards. You definitely want to pick the right prescription plan based upon your list of medications, because as we saw, it really depends on the total cost for the year is going to vary depending on the list of medications and the plan that you select for that Part D prescription plan. So I would also add Joe Namath to this slide. Listening to friends, family, and Joe Namath would be the fifth biggest mistake. Those commercials in general, there's a lot of misinformation, non-compliant information in those commercials. So you really want to be looking at this based upon your specific needs. So that is our presentation for today on the top 5 mistakes people make on Medicare. We will leave the window open for a few minutes for Q&A. Also, just want to conclude by letting you know, if you'd like, obviously, if you have questions about Medicare, if you're looking to get set up with Medicare, that's what we're here for. There is no fee to work with us. So basically, we're brokers. We do get compensated by the insurance company if we help you enroll in a plan. And you pay the same premium whether you go directly to the insurance company or if you work with a broker. So there's really no cost to you to work with us for your Medicare planning, or if you just have questions about Medicare, we're happy to help with that as well. And as Doug mentioned in the beginning, we're not captive to any particular insurance company. We work with all the A-rated insurance companies. So we'll look for the best option based upon your specific needs, whether it's United Healthcare, Aetna, Blue Cross, Cigna, Mutual of Omaha, and others. We'll find the best plan for your situation. So that's what we have for today. So like I said, I'll keep it open for another minute or two. If there's any questions, feel free to type those into that Q&A window, and we're happy to answer them here for you live. So. Rod's back. There's Doug.
Sun is shining on me.
I can see
Yeah.
that.
Good job, Justin.
Thank you.
This is a question, Justin.
Oh, let's see what came in here. All right, the question is, will you work with a client on Plan D? Yeah, so when you say Plan D, I believe you mean Part D, because Plan D is for Medigap, would be a plan that someone could get for their Medicare supplement. That would be the only Medicare supplement available to someone under 65 in New Jersey. So yes, we could help with the Medigap, at least guidance for you in that situation. If you're talking about Part D of Medicare, absolutely, we do that for all of our clients. As I mentioned earlier, the Part D analysis, when they first go on Medicare, and then also every year to make sure they have the right drug plan for the following year. Rosin, your question, how soon before you retire do you enroll? Okay, so let's, I assume the question is for someone after age 65, but essentially the earliest you can start the process for Medicare would be 3 months before your requested effective date. So for example, if you're going to be retiring March 1st, or you need Medicare to start March 1st, the earliest you could actually submit any paperwork to Medicare to get that Part B set up would be December for a March 1st effective date. So that would be the earliest to start. We would say at least 4 to 6 weeks before the effective date would be kind of the latest we'd recommend. Technically, you could submit the forms on February 27th, and you could still get a March 1st effective date. But it takes about 4 weeks to get your new Medicare card and a couple of weeks to get your supplement and drug plan. So you won't have your approvals and ID cards for a few weeks. So that's why we say, we recommend about 4 to 6 weeks before. The other
Hey, Justin, a lot of people are retiring over the age of 65. And it's funny because you tell them they have to get the form completed by their employer. And they say, well, I don't want to tell them I'm leaving, how late. So I usually say, try to do it 6 weeks before, because you do have to get that form completed, send it into Social Security, and that takes on average about 3 weeks to get done also. Don't wait to the last minute, but sooner or later, you're gonna have to ask for this proof of, group health insurance form to be completed. So it is an issue. And I want to address the one about the Part D. I know, Justin, you are flexible that we have thousands of clients that are, we do this year, we're over 1,500 drug cards that we're doing. And our clients love the fact that we contact them every year and do their drug cards, and they think it's wonderful. And they have friends, and their friends aren't being contacted by their broker, and they have the wrong drug card. And we get phone calls, hey, can you help my friend out? And it's like, a lot of the drug cards don't pay us a dime to do this. So it's almost a free service that we're providing. And some of the drug cards will pay us $30, $35 for the year just to redo a drug card, which it doesn't pay the cost of doing it. So it's really difficult for us to take on a lot of extra people that have a supplement with another agent that doesn't want to help them to just do a Part D drug card. I know, Justin, you're more flexible, but it's difficult to handle an influx of people coming in just wanting to do drug cards if we can't help them. In some cases, I've helped people with their supplements and got them a less expensive supplement or a better supplement than what they currently had, which is a possibility also. So I just want to mention that.
Yeah, thanks. Thank you. Okay. The other questions that come in, my company's deductible increased for 2022. Should I enroll in Medicare Part B to pay for the deductible? So if the company, and Rosin, in your case, has more than 20 employees at your company, the group plan is going to be your primary coverage. So even if you sign up for that Part B of Medicare, it's highly unlikely you're going to get that the amount back in what you're paying in premium in towards your claims with your company plan. So I would not recommend that in any case, really, to sign up for the Part B if you have that employer plan as your primary coverage. The other question, what if you are waiting for 65th birthday? How early can you apply? That's the same answer I would give, Orna, as the other one. So even if you're after 65, I said the earliest you can do it is 3 months before your retirement date. Same thing if you're turning 65, let's use March again, then the earliest you could start the process would be December 1st, which is 3 months before your effective date, which would be March 1st, which is the first of the month you turn 65. So it's still 3 months before. Okay. All right, some more questions. I'm on my wife's insurance. Will her employer fill form for me? Yes. So the example, just to kind of expand on the question, I'm assuming this is someone who is past the age of 65 and they are covered on an employer plan through their spouse's employer. Once the spouse leaves the health insurance, the company, even though the individual is not an employee of the company still will fill out that employer information form, and basically showing on the form there's two names. You put the employee name, which would be the wife, if the wife is the employee, and then the individual who's applying for the Part B is the second name right underneath of that. So you'd have both your names on that form when you go to sign up for that Part B. So the employer, yes, would fill that out for you as well. All right. Give it another minute, see if there's any others coming in.
Yeah, I just want to also thank everybody for joining us today. We do these on a somewhat regular basis. And again, we just view it as an educational vehicle. We do this for major corporations, or I've done it for banks and law firms. And it's just, again, it's a great employee benefit to understand this, because as employees become eligible for retirement or nearing their retirement, there's a lot of anxiety about what Medicare is and how they'll be covered. So again, we just like to go out and educate the public on this, and that's our main objective here. And hopefully you'll call us when the time comes. Thank you.
Great. Thank you, Doug. And I think that gives our time. No more questions that have come in. So thanks again, everyone, for joining. Thanks, Rod and Doug, for doing the presentation here. And hope everyone has a great rest of your day. Take care.